Good day, everyone! I am Eman P. Gilay, a midwife student from VMC Asian College Foundation Incorporated. And today, I will be performing a return demonstration on how to take our patient's vital signs. One of the very first practical skills that we should learn as a midwife student. It is how to take vital signs. The importance of measuring vital signs cannot be overstated because it serves as a fundamental indicator of an individual's health status. Healthcare professionals usually collect 5 vital signs, and today I will demonstrate on how to obtain the following readings, namely body temperature, peripheral pulse, respiration rate, oxygen saturation, and blood pressure. These measurements can be taken using basic equipment. The paraphernalia needed are a digital auxiliary thermometer using for body temperature, cotton balls, with and without alcohol for disinfection and prevention of contamination, a wristwatch with a second hand for measuring pulse rate and respiratory rate, a pulse oximeter for oxygen saturation, a stethoscope and sphygmomanometer for measuring blood pressure, and alcohol for hand hygiene before and after of the procedure. It should be 70% solution. Before starting the procedure, it is important to perform proper hand hygiene. Let us begin by hand washing. Using the World Health Organization's hand washing technique. Once done, we are ready to proceed our vital signs. And a while ago, I already performed my hand washing technique. Good morning, sir. I am Eman P. Gilay, your student midwife for today. Can I take a look at your wristband, sir?
Yes.
Sir, can you state your name, please?
I am Pumili Abdullah.
Alright. When is your birthday, sir?
January 16, 1997.
Okay. So, sir, for today, I will be checking your vital signs. This includes your body temperature, peripheral pulse, respiration rate, oxygen saturation, and your blood pressure. These are important because it provides critical information about our bodies and it assesses our well-being. Is it okay, sir, for you if I take your vital signs?
Yes, of course, no.
So, sir, first, I'll be getting your body temperature on your axillary side. And I will be using a digital thermometer and put it on your armpit. This is important for us to detect illness because there are certain diseases that are characterized by a change in body temperature. It is also an easy way for us to see if a fever is present. Can I proceed, sir?
Yes, no.
To start off, obtain the thermometer from the container. Wipe it using a cotton ball with alcohol. From the bulb to the stem. After that, dry it using a dry cotton ball in the same manner. Sir, I'll be pulling up your sleeves for me to be able to put the thermometer. Is it okay, sir? Check if the thermometer or the battery is functioning well. To obtain your client's auxiliary temperature, press the button to set the thermometer. Then you have to put the end of the thermometer securely on your client's armpit. Please hold your arm down tightly, sir, at your other side. And will I have to wait for several minutes until the thermometer beeps, which indicate that the reading is complete. While we are waiting, sir, I will begin to assess your pulse rate or the number of times your heart beats in 1 minute. We will do this to see how well your heart is working. I will be palpating your radial pulse, which can be found in your wrist because it is an easiest. Okay, sir, it already beeps. So your temperature, sir, is 36.4. And it is normal. You don't have fever.
Right after, disinfect again the thermometer used. Wipe it again with cotton balls from stem to bulb and return it into its proper container.
Okay, now, sir, we are done getting your body temperature. And we will going to proceed by getting your peripheral pulse. And first, I'm going to point or select your pulse in your body. So we have 9 pulse in our body. So first is we have your temporal, sighted in superior and lateral eye. Next is your carotid, which is on your side of the neck, your apical, left side of the chest to the left of the sternum at the 5th intercostal space, and then your brachial. The inner aspect of the biceps, muscles of the arm, medially in the antecubical space, and then your radial pulse, which is on the thumb side of the inner aspect of the wrist, and your femoral in your seeing it, sir. So femoral sighted alongside the inguinal ligament and the popliteal. So popliteal pulse is behind your knee, sir, and then your posterior tibial behind the medial malleolus, and then the last is dorsalis pedis, dorsal surface of the foot. So that are the 9 pulse of your body, sir. So, sir, I'm going to get your peripheral pulse, and I'm going to use your radial pulse to get your peripheral pulse.
Position your client and begin to assess the radial pulse rate. Support your client's wrist by grasping outer aspect of the thumb. Place your index and middle finger over your client's artery and palpate for the pulse. Do not use your thumb because it has its own pulse that you may feel. Apply just enough pressure so you can feel each beat. Do not push too hard or you will obstruct the blood flow. Count the pulse to 1 full minute. Take a look of the second hand on your watch as you count how many times you feel the pulse of your client. Assess the rhythm and volume of the pulse as well as. When counting, do not watch the clock continuously but concentrate on the beats of the pulse. Right after you obtain your client's pulse rate, do not remove your fingers from his wrist. Observe the chest movement while supposedly taking the radial pulse. It may be useful to assess the respiratory rate at the same time as pulse rate because this will give a more accurate rate and minimize any subconscious influence, as patients may alter their breathing if they know they are being observed. Using again your watch, count breaths for 1 full minute. An inhalation and exhalation is counted as 1 respiration. This is observed with the rise and fall of the chest wall. Respiratory rate is a clinical sign that represents ventilation or the movement of air in and out of our lungs. Don't forget to observe the depth, rhythm, and the character of respiration.
Okay, we are done. So, as you can see, sir, I didn't remove my hands at your wrist. because after I get your peripheral pulse, I'm also counting your respiration rate. So your RR, sir, or your respiration rate is 18, and it is normal. So after that, I'm going to hygiene again or disinfect my hand using alcohol.
Document the reading of the body temperature, peripheral pulse, and respiration, including the date, time, and method used, noting any observations.
Good morning, sir. I am Eman, your midwife student for today. And today, I will be checking your blood pressure to monitor your cardiovascular health. So, may I see your wristband, sir? Can you state your name, sir, please?
My name is Homidi Abdullah Lindunga,
And your birthday, please?
January 16, 1997.
Thank you, sir. May I have your consent to proceed with the procedure, sir?
Yes, of course, ma'am.
Thank you. So before we start, may I ask, have you smoked,
No, ma'am.
drunk coffee,
Yes.
or exercised in the last 30 minutes? Also, do you need to use the restroom?
No, ma'am.
Okay. So, this is because these factors can affect the accuracy of your blood pressure reading. Please, sir, sit comfortably with your back supported and both feet flat on the floor. Can you rest your left arm on the table at heart level? Please do not talk while I am taking your blood pressure. I have already checked that the sphygmomanometer and my stethoscope are functioning properly. I will now wrap the cuff around your upper arm about 1 inch above your elbow. The cuff should be snug but not too tight. So can I wrap up your sleeve, sir? Thank you. I am now locating your brachial artery and placing stethoscope over it. But first, I will disinfect my stethoscope first. Disinfect the earpiece and the diaphragm. And now, I will inflate the cuff to approximately 30 millimeters of mercury above the point where I last felt your pulse. And now I am releasing the pressure slowly at 2 to 3 millimeters of mercury per second. I will listen for the first sound. This is your systolic pressure. I will continue until the sound disappears. This is your diastolic pressure. All right. So, sir, your blood pressure is 120 over 80 millimeters of mercury. I am now removing the cuff. How are you feeling, sir?
It's fine.
All right. So, I will now document your blood pressure reading, sir. So, the procedure is complete. Do you have any questions, sir?
Nothing.
Thank you for your cooperation, sir. Please stay healthy and visit the health center for regular checkups. Good morning, sir. I am Eman, your midwife student for today. And today, I will be measuring your oxygen saturation level using a pulse oximeter. So this will help us check if you are getting enough oxygen in your blood. So, sir, can you state your name, please?
I am Homidi Abdullah Lindunga.
And your birthday, please?
January 16, 1997.
So, may I have your consent to proceed with the procedure, sir?
Yes, proceed.
Thank you. So, before we start, may I ask if you have nail polish or artificial nails?
No.
Also, are your hand cold? No. So, this is because nail polish and cold fingers can affect the accuracy of the reading. So now I will place the pulse oximeter on your index finger. Please keep your hands still and relax, breathing normally. So we're going to wait 10 to 15 seconds. So, your oxygen saturation is 98% and your pulse rate is 75 beats per minute. This is within the normal range. So, the normal oxygen saturation is 95 to 100%. So now, sir, I am removing the pulse oximeter. Thank you for your cooperation, sir.
You're welcome.
So, to maintain good oxygen level, remember to avoid smoking, stay in ventilated areas, and do breathing exercise daily. I will now document your vital sign. So, the procedure is complete. Do you have any questions, sir?
No more.
Okay. Thank you and keep safe always, sir. So, let me state your overall vital signs. For your body temperature, as I've mentioned earlier, it is 36.4 degrees Celsius. For the heart rate, it's 75 beats per minute. For your respiratory rate, it is 18 beats per minute. And for your blood pressure, it is 120 over 80. So 120 is your systolic and 80 is your diastolic. And your oxygen saturation level is 98%. So based on the result that we have obtained, all vital signs are normal. So there is nothing to worry about. Thank you so much, sir, and have a good day ahead. And after the procedure, we're going to perform hand washing to disinfect our hands. And